Hey everybody, let's talk about the answers to the week 2 cases. And the most likely diagnosis is a benign nevus. Now, a little bit later in the lecture, we'll explore what is going to be done for the treatment at this time. Is this person at risk? No, they're probably not at risk based upon their family prior history and their occupation. We see the risk factors there. And again, exam features, the features of this individual's mole are not suggestive of something concerning. There's some additional risk factors there from Toy et al. Pretty much the same as those risk factors in box 1019. Just interesting that chronic exposure to toxic compounds can potentially increase the risk as well as a suppressed immune system. All right, what's the most common type of melanoma? It's the superficial spreading melanoma. So hopefully you found that when you did your Google search. What I'm going to do now is we're going to be looking at the different melanomas, and I'm going to transition one slide at a time and give you 5 seconds. That's going to be, as you transition from slide to slide, hit the stop button, read through the text, and then restart the PowerPoint screencast again after that. So go ahead and pause the recording now. Okay, I had you look up definitions and pictures for the following. Same thing, pause the recording to review. Okay, the ABCDE criteria is important for us. Our job is not to diagnose something as being benign or malignant. We don't have that diagnostic ability nor the skills to be able to do that. But what our role is when a patient comes to us, if we have noticed something that is abnormal from the ABCDE criteria, then we would potentially refer them to their primary provider for examination of that structure. So for this patient, what's the treatment? Well, since it's a benign nevi or a mole, just monitoring it. Patient's educated, what to look out for, and then come back for reevaluation if things change. Now, for those individuals that exhibit the signs related to the A, B, C, D, or E, then that structure is excised or removed. If it's large and it would be cosmetically difficult, then a portion is biopsied. And then they take a look and see if it's cancerous. If it's cancerous, then they'd fully excise it from there. Once a malignancy is identified, an individual has an annual visit with a dermatologist. So what role should we play? Well, through your searching, you may have found the ABTA Oncology section, and they provide educational resources, things to look for in our patients for screening for skin cancer. And when we really have a role of assessing, screening, and educating, those are the main ones. We wouldn't really intervene unless after the fact. After somebody has had treatment, we might have some role in restoration of function. But assessment through risk factor assessment, screening through looking at the body during our normal musculoskeletal examinations, and then educating the patient based upon what we've seen and making those appropriate referrals. Takeaways here, go ahead and pause the recording and read through this. And then continuing on. Now, with this particular situation, you had the individual take their shirt off and they presented with these eruptions. Now, you may not know what's going on. The patient may not know what's going on because it is on their back. And so, is that contagious or not? So, does that lesion influence your treatment? It might. It might. You may want to have them, if they have not been seen by their provider for it, or if they have no idea what it is, there are things you might be able to initiate in the clinic, but also have them get in to see their doctor ASAP to begin treatment, because there may be things that you can't do or shouldn't do because you don't want to increase your exposure to that integumentary condition if it's contagious. Now, is the patient aware of the presentation? They might be, and they might know the diagnosis and be able to tell you what that diagnosis is, and that would allow you some comfort. But people may be self-conscious. They may be self-conscious about it, and so it's important to have that appreciation for their experience. If you were the MD, you would do the patient history and review their presentation and probably do patch testing. So this is applying allergens to the body to see if they cause a response. Skin biopsy may be considered. Treatment, avoiding the irritant, use non-prescription over-the-counter ointment, over-the-counter oral antihistamine, and avoid scratching.